going to talk about the superior view of skull. This view is the simplest view of the skull and is commonly called as a Calvario. Seen from above, the contour of Calvaria varies greatly, but is usually ellipsoid and more strictly a modified ovoid, with its greatest width lying nearest to the occipital pole. It can be drawn like this. And this is the anterior, this is the posterior. And there is a suture like this, and in the posterior portion also there is a suture, and there is a mid-sagittal suture. So four bones constitute this view and articulates via three well-defined sutures. The four bones is as follows: is a frontal bone, and the parietal bone, to express exactly two parietal bones, and occipital bone. The squamous part of the frontal bone is anterior. This is the frontal bone's squama or squamous part, and the squamous part of the occipital bone, this is the squamous part of occipital bone, is the posterior, and the two parietal bones meet in midline and separate the frontal from the occipital bone like this. The maximal parietal convexity on each side is palpable at parietal tubule or eminence around here. It is most conspicuous in the female and may be considered as a retention of the pedomorphic appearance. The superior and inferior temporal line runs close to the parietal eminence, but are best seen in lateral view from the lateral side. We can see the temporal line clearly. The boundaries of the superior view of skull may be defined as anteriorly by the superciliary arch above the orbit, and posteriorly by the external occipital protuberance, probably here, and laterally by the zygomatic arch around here. Coronal suture marks the articulation between the posterior margin of the frontal bone and the anterior margin of the two parietal bones. This is the coronal suture. The point where the three bones meet is a bregma. This is the bregma. And the coronal suture descends across the calvaria and projects inferiorly until it meets the junction between the greater wing of sphenoid bone and the squamous temporal bone at terion. Around here and here there is a terion. The sagittal suture runs in the midline between the two parietal bones and extends from the bregma anteriorly to the lambda posteriorly. So this point is a lambda, and this is the sagittal suture. The lambdoid suture delineates the articulation between the posterior border of the right and left parietal bones and the superior border of the occipital bone. So this is a lambdoidal sutures. And the vertex is the midline bony landmark at the most superior part of the calvario in the standard anatomical position near the midpoint of the sagittal suture, probably between the bregma and lambda. Vertex. Anterior portion of the vertex is called the frons, and the posterior portion to the vertex is called the occiput. The bregma represents the position of the anterior fontanelle in the young child. This diamond-shaped membrane-filled space located between the two frontal and the two parietal bones of the developing fetal skull persists until approximately 18 months after birth. The lambda at the junction of the sagittal and lambdoidal suture also represents the site of the posterior fontanelle, which persists for the first 2 or 3 months after birth. A parietal foramen may pierce either or both parietal bones near the sagittal suture, about 3.5 centimeters anterior to lambda, around here. It transmits a small emissary veins from the superior sagittal sinus. The vertex is the highest point on the skull, and it usually occupies a position in the middle third of the sagittal suture. This is the end of the superior view of the skull. Thanks for watching.